everyone, it's Jordan from Trauma. I'm going to go over with you the neuro assessment, all right? Everyone has their own way of doing a neuro assessment, but it's one of those things that we want to do at the same time every time to make sure that we're getting good, consistent neuro checks out of our patients. Y'all know how much I talk about these with our injured patients. If you have a TBI, traumatic brain injury, I would love to keep them in a CAT scan machine 24/7. They continue to tell me I'm not allowed to do that. So instead, we have neuro checks every 2, every 1, every 4, whatever it is that's ordered. This is what you're going to be doing. So I have ER Tech Shelby here with me. She's going to help me get through this neuro exam. So in your neuro trauma binders on your units, you might not be able to see this, but I did make a little index card, kind of like a cheat sheet of the major things that you should be doing in a neuro assessment. The first thing that I'm always going to look for is a GCS. If you don't know what a GCS is, it's a Glasgow Coma Scale. This is what we use to determine, in a number sense, what is my patient's mentation. So, hi, can you tell me your name?
Shelby.
And your date of birth, which you can make up.
10/18/2001.
Perfect. And do you know what today's date is?
12/20/2022.
I didn't know that, so that's okay. All right, so her GCS is 15. She's ANI times 3, she's intact. She can follow some of my commands. I will ask her though to follow some commands like, can you stick your tongue out at me? Perfect, she did a really great job with that, right? Stop asking patients to squeeze your fingers, okay? When I hold my fingers like this and ask her to squeeze them, that is a reflex. The Neuro reflex, babies do it when they come out of the womb, not because they're super smart, but because it's a reflex, right? So I don't really know if they're going back to brainstem reflexes or is she like following command that I'm giving her. But sticking out the tongue, giving me 2 fingers, that's a command that tells me they have an intact brainstem. Okay, so GCS. She's opening her eyes spontaneously, she's talking to me and she's not confused and she's following my command, so I'm gonna give her a 15 for that. Also, when she sticks her tongue out and I see that it's midline and it's straight, that's an intact cranial nerve number 12. So I just did a lot of things just talking to my patient. All right, the next thing I'm gonna do is I'm gonna check pupils. So you're gonna get your light source, whatever it is, and you're just gonna have the patient look right here at your nose while I look at your pupils. Gorgeous, gorgeous, perfect. You're looking for constriction and dilation, right? Guess what cranial nerve that is? Number 3. Every single time that you look inside of a patient's pupils looking for that movement of them, that's making sure they have an intact cranial nerve number 3. All right, next I'm gonna look for ocular movements. This is gonna be cranial nerves 4 and 6. If you get confused with cranial nerves like everyone else, it's okay, I love them. But just being able to see me, that's an intact optic nerve, cranial nerve number 2. I know that she can see me. 3, 4, and 6, let your eyes do tricks. So if you want your eyes to move, whether it's constriction and dilation or moving around in your head, that's cranial nerves 4 and 6. So I'm gonna just give her the up and down, left and right. So if you'll just follow my finger, perfect. Good, she's got an intact cranial nerves 4 and 6. You don't need to be doing all of these other field movements and cardinal signs. Just bless them. Up and down, left and right, that's enough, okay? All right, can you smile real big for me? It's symmetrical. She's got cranial nerve number 7. Can you squint really hard for me? Perfect. Very good. Some of your patients might not be able to squint too much, might be a little too much Botox, and that's okay. But she's got good sensation up here and in here, so she has an intact cranial nerve number 5, intact cranial nerve number 7, and I've already checked to see if she has her tongue sticking out and it's midline, and that's an intact cranial nerve number 12. That's a ton of cranial nerves you just did, right? She's listening to me, she can obviously hear me, so that's intact cranial nerve number 8, all right? But that's really and truly all that you need to do for that portion. Next on my list is going to be checking for pronator drift. Okay, pronator drift is determining, do I have an intact cerebellum? Cerebellum is for posture and balance. I always think that gymnasts have really big cerebellums. They don't. All right, but that's just how I remember what the cerebellum is for. All right, so to get your patient to do this, you're gonna hold both arms out, palms up, close your eyes, and you're waiting for about 5 to 10 seconds and you're looking to see if either one of them drift. Let's say if this arm drifted down, well, something might be a little wrong with her cerebellum, but she's fine. All right, perfect, thank you. The next thing that I'm doing on my list here is testing for muscle strength, okay? I need to know her grip strengths. I need to know the muscle strength of all of her extremities here because that tells me if she was a 5 out of 5 strength this morning and now she's a 4 out of 5, something's happening in her neuro, okay? So the first thing I have my patient is give me some chicken wings, just like this. All right, resist me and pull up. Oh, very good. Same thing with the arms like this. Push against me, pull against me. You can do the fingers. So again, make for fingers. Don't let me push them together. Very good, perfect. And you can do grip strength at this point. The next thing I do is pull foot up against me, pull foot up against me. All right. And then you come down here, push on the gas, lift up. She's 5 out of 5. She is resisting me really strong. All right. Some patients, they're not able to put their leg up at all, or I have to passively put it up, but when I'm gonna let you go and you just drop it down. Ready? They don't resist gravity. All right, on Epic, it's gonna give you the grading scale. I have to look at it too, okay? And that's okay, but just be consistent with that in your neuro check. And the final thing is, do you feel my hands touching here? Do you feel my hands touching here? Is it equal on both sides? She is neuro intact, all right? That is your perfect neuro exam. That's what you should be doing every single time that you go into your patient for TBI checks. Thank you.